Top 25 Personal Care Assistant Interview Questions and Answers. This guide presents practical personal care assistant interview questions and answers to build confidence, showcase compassion, and help candidates communicate skills clearly for hiring outcomes. 1. What is the role of a personal care assistant? A personal care assistant provides compassionate support with daily living activities while promoting dignity, safety, and independence. Core duties include assisting with bathing, dressing, grooming, mobility, toileting, meal preparation, medication reminders, and light housekeeping. The role also involves observing changes in a client's condition, documenting care, and communicating with families and healthcare professionals. Strong interpersonal skills are essential to build trust and provide emotional support. Time management, reliability, and respect for confidentiality guide daily practice. Ultimately, a personal care assistant improves quality of life by delivering consistent, person-centered care that respects preferences, routines, and cultural values every single day. 2. Why do you want to become a personal care assistant? I am drawn to personal care assisting because I value helping people maintain dignity, comfort, and independence. Supporting vulnerable individuals feels meaningful and aligns with my compassionate nature. I enjoy building trusting relationships, listening carefully, and adapting care to individual needs. The role allows me to use patience, empathy, and practical skills every day. I am motivated by seeing small improvements in a client's well-being and knowing my presence reduces loneliness and anxiety. I also appreciate the responsibility and professionalism the role requires. Continuous learning in care practices excites me, and I am committed to providing respectful, reliable support that. 3. How do you handle difficult or challenging client behavior? When handling challenging behavior, I remain calm, patient, and respectful. I first try to understand the underlying cause, such as pain, confusion, fear, or frustration. Active listening and gentle reassurance can often reduce distress. I avoid arguing and instead validate feelings while setting clear, supportive boundaries. If needed, I use distraction techniques or adjust the environment to promote comfort. I always follow care plans and organizational policies to ensure safety. Documenting incidents and communicating with supervisors or healthcare professionals helps improve future care. My goal is to protect dignity while responding thoughtfully, ensuring the client feels heard, safe, and supported. 4. How do you ensure client safety at all times? I ensure client safety by following established care plans, using correct manual handling techniques, and maintaining a hazard-free environment. I regularly check equipment, keep walkways clear, and support mobility with appropriate aids. Infection prevention practices, including hand hygiene and proper use of protective equipment, are essential. I stay alert to changes in a client's condition and report concerns promptly. Medication reminders are provided according to guidelines, never beyond my scope. Clear communication with clients and families reduces misunderstandings. By staying attentive, organized, and proactive, I help prevent accidents and create a secure, reassuring environment where clients can live as independently as possible. 5. How do you communicate effectively with clients and families? Effective communication with clients requires patience, clarity, and empathy. I use simple, respectful language and adapt my tone to match individual needs. Active listening helps me understand preferences, concerns, and emotional cues. Nonverbal communication, such as eye contact and gentle body language, also builds trust. I involve clients in decisions whenever possible to support autonomy. With families and professionals, I provide accurate updates while respecting confidentiality. Asking open-ended questions encourages collaboration and prevents misunderstandings. Consistent communication improves care outcomes. By prioritizing understanding and respect, I create a supportive atmosphere where everyone feels valued and informed always. 6. What does confidentiality mean to you in care work? Confidentiality is fundamental to ethical care. I protect client privacy by discussing personal information only with authorized individuals and in appropriate settings. I follow organizational policies and data protection regulations at all times. When speaking with families, I confirm consent before sharing sensitive details. Respecting confidentiality builds trust and reassures clients that their dignity is valued. Maintaining strict confidentiality demonstrates professionalism and ensures that clients feel safe, respected, and confident in the care they receive. 7. How do you manage your time during busy shifts? Time management is essential in a busy care environment. I begin by reviewing schedules, prioritizing urgent tasks, and organizing supplies in advance. Breaking work into manageable steps helps me stay focused and efficient. I use checklists and reminders to ensure nothing is missed. While working efficiently, I remain flexible when unexpected needs arise. Communicating early with supervisors allows adjustments when workloads change. I also respect each client's pace, balancing productivity with compassionate attention. By staying organized, punctual, and adaptable, I consistently meet responsibilities without compromising care quality, ensuring that every client receives support consistently daily. 8. Why is teamwork important in a care setting? Teamwork is critical for delivering high-quality care. I collaborate openly with nurses, therapists, supervisors, and fellow assistants to ensure consistent support. Sharing observations about a client's condition helps the team make informed decisions. I welcome feedback and contribute ideas respectfully. When challenges arise, I focus on solutions rather than blame. Clear communication, reliability, and mutual respect strengthen working relationships. I understand my role within the wider care team and follow instructions carefully. By supporting colleagues and valuing collaboration, I help create a positive environment that benefits staff morale and, most importantly, improves outcomes for clients every day, everywhere consistently. 9. How do you follow infection control procedures? Infection control protects both clients and staff. I follow strict hand hygiene practices before and after every interaction. Personal protective equipment is used correctly according to risk assessments. I clean and disinfect surfaces, equipment, and frequently touched areas regularly. Safe disposal of waste and laundry procedures are always followed. I avoid cross-contamination by using dedicated supplies for each client when required. Staying informed about infection prevention guidelines ensures my practice remains current. By being consistent and vigilant, I reduce the risk of illness transmission. Strong infection control practices demonstrate professionalism and help maintain a safe, healthy environment for everyone. 11. How do you respect a client's dignity and independence? Respecting dignity and independence means treating every client as an individual with personal preferences, choices, and rights. I always ask for consent before providing care and explain each step clearly. I encourage clients to do as much as they can for themselves, even when tasks take longer. This supports confidence and self-esteem. I respect privacy by closing doors, covering appropriately, and speaking respectfully. Cultural values, routines, and personal beliefs are always considered. By listening carefully and involving clients in decisions, I help them feel valued rather than dependent. Preserving dignity strengthens trust and ensures care remains compassionate, respectful, and person-centered. 12. How would you support a client with dementia? Supporting a client with dementia requires patience, consistency, and understanding. I use calm communication, simple instructions, and gentle reassurance to reduce confusion. Maintaining familiar routines helps clients feel safe and secure. I avoid correcting harshly and instead redirect conversations when needed. Observing behavior helps me identify triggers for anxiety or distress. Creating a supportive environment with minimal noise and clear cues improves comfort. I also document changes in behavior and report concerns to supervisors. Most importantly, I treat every client with respect and empathy. Compassionate care helps people with dementia feel understood, safe, and valued throughout their daily lives. 13. How do you handle stress in a demanding care role? Care work can be emotionally and physically demanding, so managing stress is essential. I stay organized, prioritize tasks, and take short mental pauses when possible. Deep breathing and positive self-talk help me remain calm during challenging situations. I also seek support from colleagues and supervisors when workloads become overwhelming. Maintaining healthy habits outside work, such as rest, hydration, and exercise, improves resilience. Reflecting on positive moments with clients reminds me why the work is meaningful. By managing stress effectively, I remain focused, patient, and professional. This ensures that clients continue to receive consistent, high-quality care every day. 14. What would you do if a client refused care? If a client refuses care, I remain calm and respectful. I try to understand the reason behind the refusal by listening carefully and asking gentle questions. Sometimes fear, discomfort, or loss of control causes resistance. I explain the importance of the care clearly and offer choices to give the client a sense of control. If refusal continues, I do not force care. Instead, I document the situation and inform my supervisor. Respecting autonomy while ensuring safety is essential. By using patience, empathy, and communication, I often find that clients become more comfortable and eventually accept support willingly. 15. How do you handle emergencies in a care setting? In an emergency, I stay calm and act quickly according to training and policy. I assess the situation, ensure the client's immediate safety, and call for medical assistance when required. I follow emergency procedures such as contacting supervisors, calling emergency services, or providing basic first aid within my scope. Clear communication is essential to prevent confusion. I document the incident accurately after the situation is under control. Regular training helps me stay prepared for unexpected events. By remaining composed and focused, I protect clients and ensure that emergencies are managed efficiently, professionally, and with the highest priority on safety. 16. Why is empathy important for a personal care assistant? Empathy allows a personal care assistant to truly understand how clients feel. Many clients experience loneliness, illness, or loss of independence. When I show empathy, clients feel heard, respected, and supported. This strengthens trust and improves cooperation with care. Empathy also helps me respond sensitively to emotional needs, not just physical tasks. It encourages patience during difficult moments and supports better communication. By putting myself in the client's position, I can deliver more compassionate and personalized care. Empathy transforms routine tasks into meaningful support, ensuring that care feels human, respectful, and emotionally supportive at all times. 17. How do you adapt care for different client needs? Every client has unique needs, so flexibility is essential. I begin by understanding each individual's care plan, preferences, and limitations. Some clients may require physical assistance, while others need emotional reassurance or companionship. I adjust my communication style, depending on age, cognitive ability, and cultural background. I also respect personal routines, such as meal times and sleep habits. Observing changes in condition helps me adapt care as needs evolve. By staying attentive and open-minded, I provide personalized support rather than using a one-size-fits-all approach. This improves comfort, dignity, and overall quality of care. 18. How you handle feedback or criticism from supervisors. I view feedback as an opportunity to grow and improve. When supervisors provide guidance, I listen carefully without becoming defensive. I ask questions if something is unclear and reflect on how I can apply the advice. Constructive criticism helps me strengthen my skills and improve the quality of care I deliver. I appreciate honest feedback because it supports professional development. If I make a mistake, I take responsibility and learn from the experience. By remaining open to feedback, I show professionalism and commitment. This positive attitude contributes to better teamwork, stronger performance, and consistently higher standards of care. 19. How do you maintain professional boundaries with clients? Maintaining professional boundaries protects both the client and the care worker. I am friendly, kind, and supportive while keeping the relationship respectful and appropriate. I avoid sharing excessive personal information and do not become emotionally dependent on clients. I follow workplace policies regarding gifts, social media, and outside contact. Clear boundaries ensure that care remains focused on the client's needs. If a situation feels unclear, I seek guidance from a supervisor. By maintaining professionalism, I create a safe environment where trust is built without crossing boundaries. This protects the integrity of care and supports ethical, responsible practice. 20. What qualities make a great personal care assistant? A great personal care assistant is compassionate, patient, reliable, and respectful. Strong communication skills help build trust with clients and families. Empathy allows deeper understanding of emotional and physical needs. Good time management ensures responsibilities are completed consistently. Adaptability is essential because every day can be different. Professionalism, confidentiality, and accountability protect clients and uphold standards. A willingness to learn helps improve care practices over time. Most importantly, genuine care for others makes a real difference. When these qualities are combined, a personal care assistant can provide meaningful support that improves quality of life and creates a positive care experience. 21. How do you support clients with mobility difficulties? Supporting clients with mobility difficulties requires patience, safety awareness, and proper technique. I always follow the care plan and use correct manual handling methods to prevent injury. I encourage clients to move as independently as possible while providing support when needed. Mobility aids such as walkers or wheelchairs are used correctly and checked for safety. I ensure the environment is free from obstacles to reduce fall risks. I move at the client's pace and offer reassurance to build confidence. By being attentive and supportive, I help clients maintain independence while ensuring their comfort, dignity, and safety during daily activities. 22. How do you deal with cultural differences in care? Cultural awareness is essential in providing respectful care. I take time to learn about each client's cultural background, beliefs, and preferences. This includes understanding dietary requirements, religious practices, communication styles, and personal boundaries. I never make assumptions and always ask respectful questions when unsure. Respecting cultural differences helps clients feel valued and understood. I adapt my care approach to ensure it aligns with their traditions and values. By being open-minded and respectful, I build trust and improve relationships. Cultural sensitivity strengthens person-centered care and ensures that every client receives support that honors their identity and individuality. 23. How do you stay motivated in care work? I stay motivated by focusing on the positive impact my work has on clients' lives. Small improvements, smiles, and expressions of gratitude remind me that my efforts matter. Setting personal goals helps me stay focused and engaged. I also continue learning to improve my skills and confidence. Supporting clients through difficult moments gives my work purpose. I build strong connections with colleagues, which creates a supportive work environment. Even on challenging days, I remind myself why I chose this career. Staying motivated allows me to consistently provide compassionate, reliable care and maintain a positive attitude that benefits both clients and the care team. 24. What would you do if you suspected abuse or neglect? If I suspected abuse or neglect, I would take the situation very seriously. I would observe carefully and document any signs, such as unexplained injuries, changes in behavior, or poor living conditions. I would not confront the suspected abuser directly, as this could put the client at greater risk. Instead, I would report my concerns immediately to my supervisor or follow safeguarding procedures. Protecting the client's safety is always a priority. Confidentiality is maintained while ensuring the right professionals are informed. By acting promptly and responsibly, I help protect vulnerable individuals and support a safe, respectful care environment. 25. Why should we hire you as a personal care assistant? You should hire me because I am compassionate, reliable, and committed to providing high-quality care. I understand the importance of dignity, respect, and person-centered support. I communicate clearly, follow care plans carefully, and work well within a team. I take responsibilities seriously and always strive to improve my skills. Clients can trust me to be patient, attentive, and supportive in every situation. I bring a positive attitude and strong work ethic to the role. My goal is to make a genuine difference in clients' lives by providing consistent, respectful care they can depend on. Preparing for a personal care assistant interview requires confidence, empathy, and clear communication. By understanding these common questions and practicing thoughtful responses, candidates can demonstrate professionalism, compassion, and readiness to deliver high-quality, person-centered care in any care environment.